The CDC has released new guidelines for people who are fully vaccinated against the coronavirus. The agency now says fully vaccinated Americans can unmask when walking, running, or biking outside with members of their household. They can also feel safe unmasking at small outdoor gatherings with vaccinated and unvaccinated people. The CDC says those who are fully vaccinated can safely dine outside at restaurants with people from other households without wearing a mask. However, masks should still be worn at crowded outdoor settings and venues. The CDC says those who are fully vaccinated should still wear masks for many indoor activities, including riding public transportation, going to movie theaters, and attending full-capacity worship services. Fully vaccinated people should also mask up at small indoor gatherings with vaccinated and unvaccinated people from multiple households. CDC Director Rochelle Walensky spoke of the hope vaccinations are bringing for a return to normalcy.
The examples today show that when you are fully vaccinated, you can return to many activities safely, and most of them outdoors and unmasked, and begin to get back to normal. And the more people who are vaccinated, the more steps we can take towards spending time with people we love, doing the things we love to enjoy. I hope this message is encouraging for you. It shows just how powerful these vaccines are in our efforts to end this pandemic, and why we are asking everyone to roll up their sleeves and get vaccinated.
President Biden spoke outside of the White House earlier, where he called on people to get vaccinated to help us all get back to normal.
The bottom line is clear. If you're vaccinated, you can do more things more safely, both outdoors as well as indoors. So for those who haven't gotten their vaccination yet, especially if you're younger or think you don't need it, this is another great reason to go get vaccinated now. Yes, the vaccines are about saving your life, but also the lives of the people around you.
For more, I want to bring in Alonzo Plough. He's the Chief Science Officer at the Robert Wood Johnson Foundation and a former Health Department Director in Boston and Seattle. Alonzo, welcome. Thank you so much for being with us. So do you agree with these new suggestions for both indoor and outdoor activities? What are your thoughts?
Yes, I do. These are very solid suggestions based on the continuing evidence that CDC has been developing. And as Dr. Walensky said, the good news is if you are fully vaccinated, there are just a wide range of activities outdoors that you could do safely. But the real bottom line, I think, to this guidance is that the key to being able to do all the things we like to do with our friends and loved ones is rolling up your arm and getting vaccinated.
Absolutely. I want to ask about this idea of being inside and being socially distanced. A study released by MIT found that social distancing inside does not offer much protection in some scenarios. Do you think some people may be getting a false sense of security through this indoor social distancing?
I think the social distancing has always been coupled with mask wearing. So if we are assiduous with wearing masks indoors, and again, the CDC guideline suggested even fully vaccinated people in smaller indoor places wear masks, that is the key to the protection.
And the CDC is saying that millions of Americans are not showing up for their second dose of the COVID-19 vaccine. What are the ramifications of this?
Very serious ramifications. Nearly 8% of Americans, 5 million people, have not come for their second dose. And all the studies on efficacy shows that you need that second dose for the two vaccines, the Pfizer and Moderna, that require a second dose. So fully vaccinated means that you are 2 weeks past the number of doses that you're supposed to get. 2 in the case of those vaccines, or 1 in the case of J&J. So again, you do not have the protection that you should have if you do not follow your full course of vaccination, and we just won't get back to something like normal as a country unless we get that level of population vaccination.
Now, one thing that was interesting is that official vaccine guidance for pregnant people has not changed at all. So, despite the CDC director saying last week that the CDC recommends pregnant people receive the vaccine, why is the agency hesitant at all to advise vaccinations during pregnancy?
I think that there is consistency in the message because of obviously the individual health considerations that any pregnant person needs to take. A consultation with their physician is advisable, but the CDC is very clear on recommending that pregnant people be vaccinated. If there's a question, they should talk to their doctor.
All right. Well, Dr. Plough, thank you so much for joining us. It's always a good feeling when we seem to be making enough progress that guidance is loosened somewhat. Thank you for joining us.
Thank you for having me.